It's been 8 months since the start of the COVID-19 pandemic, and 250,000 Americans have died. There are nearly 11.5 million confirmed cases in the U.S. More than 76,000 people are hospitalized with the coronavirus, and many hospitals are reaching their breaking points. More than 24 states are now tightening restrictions related to the pandemic. Thursday marks the first day of a statewide 3-week curfew in Ohio. In California, Los Angeles County is also imposing a 10 p.m. curfew for bars and restaurants. But there have been some promising news this week on vaccines. Pfizer announced its vaccine is 95% effective. The company also said Wednesday there are no serious safety concerns. It's preparing to ask the Food and Drug Administration for emergency use authorization. However, we're following a major setback on the road to recovery for New York City. The nation's largest public school system says it is canceling in-person learning starting Thursday. This came after the city's 7-day positivity rate reached 3%. The shutdown affects 250,000 students and their parents. Here's CBS News correspondent Mola Lenghi.
The nation's largest public school system will cancel all in-person classes, going only online beginning tomorrow. That's after New York City has reached a 3% positivity rate. Now, you remember, it was just 8 weeks ago that schools were back in session here in New York City. Students received only a 24-hour notice, leaving working parents in an incredibly tough spot.
A painful about face for New York City.
We do need to close our schools for the coming days. No one is happy about this decision.
New York City was the first major city to reopen schools this fall, and the decision to close is not sitting well with the parents of the nearly 300,000 children affected.
School is closing tomorrow for an undetermined amount of time.
Why? Muga Yafi has a first grader.
It's really disappointing for parents. We're constantly scrambling. Every day it feels like we're waiting for the shoe to drop.
Adding to the confusion, bars, restaurants, and gyms will all remain open. It was a bitter pill to swallow on a day when one of the leading vaccines got a huge boost. Drug maker Pfizer says it will apply for FDA emergency approval within days after late-stage trials found its vaccine to be 95% effective with no serious side effects.
This vaccine looks extremely promising to help us end this pandemic.
Dr. Edward Walsh headed up one of Pfizer's phase 3 trials at the University of Rochester.
The benefit is enormous, and the risks are very small.
U.S. healthcare workers, the first in line for a vaccine once it's approved, could get their shots in about a month.
If we could hang on and implement the public health measures, that help is really on the way.
Other big news is the FDA approval of an at-home self-test that provides results in 30 minutes or less and costs less than $50. You do need a prescription, and it's not widely available until spring 2021. With a week to go before the Thanksgiving holiday, public officials are not taking any chances.
You don't want to be the turkey on Thanksgiving.
Americans are looking for the all clear, lining up by the thousands across the country to get tested.
I'm nervous about, if I get, sick, I don't want to get my family sick.
The CDC says the safest holiday this year is the one celebrated with your household. But if you are hosting, gatherings should be outdoors with a small group. Guests should bring their own food and wear masks. Around the country, governors are continuing to sound the alarm.
Arizona and our nation remain in a public health emergency, and getting back to normal isn't in the cards right now.
There are growing fears that hospitals in the hardest hit areas will be overwhelmed as doctors and nurses speak of nightmare situations now unfolding.
I think a lot of us now are in kind of, for lack of a better word, siege mentality. It is fatigue beyond fatigue.
A comprehensive new study suggests that coronavirus patients maintain a significant level of immunity for at least 8 months, suggesting that if you've had the virus and recovered, you could be immune from reinfection for a considerable amount of time. Now, this study still needs to be peer-reviewed, Lana, but it is showing some promising results.
Good to hear some promising news. Thank you, Mola. For more on this now, I am joined by Randi Weingarten. She's the president of the American Federation of Teachers. Randi, thank you for being with us tonight. New York City Mayor Bill de Blasio and other education officials warned parents and school faculty over the summer that in-person learning would be halted if the positivity rate reached 3%. How was that specific threshold established?
Well, I think so. First off, it's a tragic day for everybody because there's no good choices. And I think what the mayor did was, given where the situation was at the time, which was less than about 1%, their concern was that if it actually did escalate to 3%, it could be higher. And what has unfortunately happened, as I understand it from New York City, is that you're starting to see a real spike in lots of different places. But from
Randy, I'm afraid that we have a terrible. Randy, I'm afraid we have a terrible connection.
Number, I think because of what, but the bottom line is, or the beginning of March. But the bottom line is this. It was the number that everybody understood that citywide schools would close if it exceeded that point. And in the last several days, because of the spike all over the city, it was hovering there. Now, no one wants to have schools closed, but no one wants schools to be a super spreader event. And let's actually take a step back and say how proud we are that New York City was the only major school district in the nation to actually do the safety safeguards in schools, including testing, to actually reopen schools in that kind of hybrid model. And so over the course of the next few days, the city is going to have to work on how to get that number down. But that also means that bars and gyms and restaurants have to do their part too. And everyone in the city has to start wearing a mask and has to do their part too. The teachers want to teach. They know how to do things remotely, but they want to do it.
On that point, though, Randi, many health experts argue that the data shows that children are not driving this recent surge of coronavirus cases. In fact, numbers from the New York City Department of Education shows that between October 9th and November 16th, the positivity rate at public schools was just 0.23%. You mentioned gyms and outdoor dining. I wonder how you feel about schools being the first to close as opposed to some of those other things. Is this actually a problem of spread in the schools, or is it a problem of staffing, given that the positivity rates in the city are increasing and we know that this virus is affecting adults more than children?
Well, the problem is, if it's the problem of staffing, it's the problem of schools, because at the end of the day, this is the good news that we've learned, that schools in and of themselves are not super spread if you have the safety that New York put in. The bad news is that, as the doctors and others will tell us, community spread is key to whether or not you can keep schools open. And what's happening is that there's too much community spread in New York City, and those are the numbers that you have to drive down. And you're absolutely right; those numbers have to be driven down. But the effect is that community spread brings things into schools, and that's why that number was set that way. As I said, our union has tried to reopen schools safely across the country. We've been trying to do this since last April, and it's pretty frustrating to teachers who actually want to be in school teaching kids that we seem to be the only ones that are really, really focused on what Dr. Fauci and Dr. Birx are saying, and ultimately what the president did not do.
Yeah, I've heard the expression of frustration coming from friends who are teachers as well as parents. Along those lines, parents and teachers were given less than 24 hours notice about schools closing in New York City. Could this have been handled better?
Look, everything could be handled better in the moment of COVID. So, but, and but what I had heard the mayor say, with all due respect to him, is that every day they've been saying that if schools got to the 3% mark, they would then close schools. I think what's happened is that we're all so fatigued about all of this. We had hoped against hope that we wouldn't get to the 3% mark.
Yeah, you're absolutely right about both the fatigue and the desire that this pandemic be over.
Yeah.
New York City Schools Chancellor Richard Carranza also announced that 60,000 students still don't have access to remote learning devices. Are New York City schools actually prepared to go fully remote with so many students without access to the technology? How will this also affect some of the most vulnerable learners that we know teachers are trying so hard to serve, but without the technology there, do we risk them really being left behind?
Well, that's been the problem. So, I appreciate everything that you're saying, because the frustration that you're hearing in my voice is real. We've been fighting for the technology issues, not just in New York City, but across the country for months and months. This technology, it's not just the devices, it's connectivity at home. But frankly, this is a problem now for homeless shelters and has been since March. It's a problem in the city since March. What I would beg Spectrum and the other connectivity companies to do is give connectivity to parents for free. And then what happens is that we can use any kind of devices for kids in terms of remote education. The best devices are to actually have not a laptop, or not a iPad, but a laptop. But this is part of the reason why we have fought every single day since April to get a stimulus for states and for schools. There are 15 million people nationwide, 15 million kids that don't have connectivity. And we need to do that for our kids. But there's no good choices here, which is part of the reason why our union tried, doing everything they could to get schools reopened in the city. And if we can work to drive down those rates, I know that Mike Mulgrew and others are working on seeing if we could try to do a regional approach.
Yeah, Randy, we did talk last time. Last time you and I spoke, I remember discussing federal stimulus, and actually last time I spoke with you, you were campaigning for now President-elect Biden on your big bus. You got your desire, you got your candidate, and now you're on several lists speculating about education secretary. Before I let you go, would you take a position in the Biden administration if you were asked to serve?
Look, it's an honor. Children and teachers have been the cause of my life. And I have always tried to find ways to do things that are good for kids and fair for teachers. So it's an honor to be mentioned. But right now, frankly, I am really focused on how we get a stimulus, how we get the COVID under control, how we get schools reopened safely, how we get kids a decent education, how we get the computers to kids, how we get kids fed. That's what I'm focused on, and I'd be honored to work with the Biden administration right from my perch as the head of the AFT.
All right, Randy, thank you for giving us so much time on the heels of this very big announcement coming from New York City. Randy Weingarten, thank you.
Thank you.